Hello everyone, welcome back to Sowkya Vision. Today we are going to start with the discussion of neck. The neck is divided into different triangles to make to remember structures that present in neck, to study the structures to make easy. Okay, today we are going to discuss the posterior triangle of neck. The side of triangle is quadrilateral, so to the quadrilateral structure of triangles is divided into anterior and the posterior triangle. Yes, by sternocleidomastoid muscle. Yes, the side of neck is quadrangular. So, this quadrangular neck is divided into anterior and posterior triangles by sternocleidomastoid. Yes, the sternocleidomastoid is extending from sternum and clavicle. Cleido means clavicle, right? So, it is extending from sternum and clavicle and inserting it mastoid process of temporal bone. Yes, we have mastoid process to the temporal bone, right? So this sternocleidomastoid is going to insert at the mastoid process of the temporal bone. So the triangles of the neck are divided into anterior and posterior triangle by sternocleidomastoid muscle, that is extending from sternum clavicle to the mastoid process. So today in this video we are going to see the posterior triangle. It is a large triangle. So we are going to discuss, we are going to complete the structure, what are present in the posterior triangles and the borders we are going to see in this video. Okay, let's start with the video. Now, as I said, these are divided into triangles, so obviously it is a triangular space. Yes, it is a triangular space that is present behind the sternum. Okay, the space, see, let's discuss in the diagram. This is the sternum. Yes, this is the sternum that is extending from sternum. This is the sternocleidomastoid that is extending from sternum clavicle to the mastoid process. Here we will have mastoid process. This muscle is going to end here. So the part behind sternocleidomastoid and in front of trapezius muscle, the space between sternocleidomastoid and the trapezius muscle is considered as the posterior triangle of the neck. Yes, we are having either side, the right side and the left side. We are going to discuss only one side of the neck. Okay, this part is known as posterior triangle. This is the sternocleidomastoid and this is the trapezius muscle that is present in the back of body, right? So the space present between sternocleidomastoid and the trapezius is known as posterior triangle of the neck. Yes, now let's see the borders of posterior triangle. The anterior border of the posterior triangle is formed by the posterior border of sternocleidomastoid. Yes, the sternocleidomastoid is having two borders. This is the anterior border and this is the posterior border. So this is a triangle, right? This is the triangle. Now the triangle's anterior border is made by the posterior border of the sternocleidomastoid. Yes, the anterior border of sternocleidomastoid and this is the posterior border of sternocleidomastoid. So this is the triangle. This will be the anterior border. So anterior border is formed by the posterior border of the sternocleidomastoid. Yes, and the posterior border is formed by anterior border of the trapezius muscle. As I said, the posterior border of the neck is extending from the posterior border of the sternocleidomastoid and the anterior border of the trapezius muscle, right? So this is the trapezius muscle that is extending from the back of neck to the back of body. Yes, this is having anterior border. This is the anterior border of the trapezius, right? So the anterior border of the trapezius is forming the posterior border of the posterior triangle of neck. Anterior border of the trapezius muscle is forming posterior border, whereas posterior border of the sternocleidomastoid is forming anterior border of the posterior triangle, right? Now apex. As it is a triangle containing apex, a base, roof, right? Now the apex is the meeting of anterior and posterior border. Now where these two borders are meeting, as I said, the sternocleidomastoid is extending from sternum clavicle and inserting it where it is inserting it mastoid process, right? So these two muscles, this trapezius muscle and the sternocleidomastoid muscles are going to meet at mastoid process. Yes, that point becomes the apex of the posterior triangle of neck. Now we will see the base. The base is superior aspect of middle 1/3 of clavicle. Here we see. This is the clavicle, right? This is the clavicle and this is the sternum. So the middle 1/3 of the clavicle is superior aspect. Middle 1/3 of the clavicle becomes the base. Yes, this part becomes the base of posterior triangle. And now roof. Roof is formed by investing layer of deep cervical fascia, superficial fascia, the superficial fascia containing platysma, external jugular vein, posterior jugular vein, and nerves and vessels. Yes, the roof is formed by investing layer of deep cervical fascia. This is a deep fascia that present in the neck. Okay, and superficial fascia. The superficial fascia considers platysma, external jugular vein, posterior jugular vein, nerves and vessels. Now, what are the structures that are present in the roof? There are cutaneous nerves. Okay, what are the cutaneous nerves? Lesser occipital nerve, greater auricular nerve, transverse cervical nerve, and supraclavicular nerve. Let's see these structures in the diagram. Okay, now what is the first one? Lesser occipital nerve. This is the lesser occipital nerve. Yes, this is the lesser occipital nerve. Greater auricular nerve. This is a greater auricular nerve. Transverse cervical nerve. This is a transverse. Supraclavicular. This is the 1, 2, 3 and 4. These are the 4 cutaneous nerves that are present in the roof of posterior triangle. Yes. Now floor. What is the floor made of? The floor is made of muscles. Hence it is a muscular. So floor is made up of muscles. So there are 4 muscles. What are they? Semispinalis capitis, splenius capitis, levator scapula, scalenius medius. These are the 4 muscles that are going to form the floor of the posterior triangle. Yes, once again, the anterior border. Let's discuss in the diagram. The anterior border is formed by the posterior border of the sternocleidomastoid, and the posterior border of the posterior triangle is formed by the anterior border of the trapezius muscle. Right, and the apex is formed by the meeting point of 2 borders, anterior and the posterior border, where the 2 borders meet, that point becomes apex. Right, now the base is formed by the superior aspect of middle 1/3 of the clavicle. Yes, and the floor is formed by muscles. What are the 4 muscles? Semispinalis capitis, splenius capitis, levator scapula and scalenius medius. These are the 4 muscles that are going to form the floor. Now what is the roof is formed by? The roof is formed by the investing layer of deep cervical fascia and superficial fascia. Superficial fascia containing platysma, external jugular vein, posterior jugular vein, nerves and vessels. So the roof is containing 4 cutaneous nerves. What are the 4 cutaneous nerves? The lesser occipital nerve, greater auricular nerve, transverse cervical nerve and supraclavicular nerve. These are the 4 cutaneous nerves that are present in the roof. Okay, these are the borders of posterior triangle. So what are the contents of posterior triangle? Okay, the posterior triangle is very large, right? So to remember the structures easily, the posterior triangle is divided into occipital triangle and the subclavian triangle. Why? To remember structures easily. Okay, so the lowest part of posterior triangle, this is the lowest part. Yes, this is the lowest part, right? This lowest part of the triangle is divided into occipital and subclavian triangle by the inferior belly of omohyoid. Yes, it is divided into occipital triangle and subclavian triangle by passage of inferior belly of omohyoid. See. This is the inferior belly of omohyoid. This is complete posterior triangle, right? So this is the inferior belly of omohyoid. We have 2 bellies for the omohyoid, inferior and the superior. So here the inferior belly of omohyoid is dividing posterior triangle into occipital and the subclavian triangle. Okay, now what is the occipital triangle? The occipital triangle is this part. Yes, this part is the occipital triangle. This large triangle is the occipital, whereas this small is the subclavian triangle. Now, what are the structures that are present in the occipital triangle? Very simple. The 4 cutaneous nerves in the roof, as I said. What are the 4 cutaneous nerves? Lesser occipital, greater auricular, transverse cervical and supraclavicular. Right? These 4 along with spinal accessory nerve, 3rd and 4th cervical nerve. What is the spinal accessory nerve? It is a cranial nerve. Okay? One cranial nerve, 4 cervical, 3rd and 4th cervical nerve, that is 2 cervical nerves, 1 dorsal scapular nerve, 4 cutaneous as they are present in the roof of triangle, superficial transverse cervical artery and occipital artery. Very easy to remember. 1 is a cranial nerve, 2 are the cervical nerve, One is the dorsal scapular nerve, 4 are the cutaneous and 2 arteries, superficial transverse cervical artery and occipital artery. Okay, these are the structures that are present in the occipital triangle. So what are the structures present in the subclavian triangle? Mainly the trunk of brachial plexus. Yes, the trunks, the brachial plexus containing branches, cords, trunks. Yes, so the trunks of the brachial plexus are laid in the subclavian triangle. What are the structures? The third part of the subclavian artery. The subclavian artery is the major artery containing 3 parts. First, second and third part. So the third part of the subclavian artery is present in the subclavian triangle. So along with that we have the subclavian vein, trunks of brachial plexus and some lymph nodes. Okay, these are the structures of the occipital and the subclavian triangle. Once again, apex is formed by meeting point of anterior and posterior border. Base is formed by the superior aspect of middle 1/3 of the clavicle. Floor is formed by the 4 muscles. Roof is formed by the deep fascia and superficial fascia that containing 4 cutaneous nerve. Anterior border is formed by the posterior border of sternocleidomastoid and posterior border is formed by the anterior border of the trapezius. And that large triangle is divided into occipital and the subclavian triangle by inferior belly of omohyoid to remember the structures easily. Okay, these are the structures that present in the occipital triangle and the subclavian triangle. This is complete discussion of posterior triangle of neck. If you have any doubt, please comment in the comment section. If you like the video, please do like the video, subscribe to the channel. Namaste.